I'm Dr. Tahsin Zatman, and I'm one of the consultant anaesthetists here in the Practice Plus group. You're going to be coming in for your operation for your hip or your knee. The majority of people will have a spinal anaesthetic. The spinal anaesthetic allows us to give you really good pain relief through your procedure, but also into the post-operative period. And it's one of the safest ways of giving you an anaesthetic. The spinal itself is really like getting yourself into a warm bath. So you'll start feeling tingling sensations in your feet and probably your bottom, and then you'll get a warm sensation which comes up the body to your waist. You won't be able to feel anything. You won't certainly be able to move, and that's quite normal. It lasts for about 4 hours, and then the sensations will come back with the tingling sensation first, and then you'll be able to have full mobility of your limbs about 5 to 6 hours later. We do recommend that you don't get out of bed, and you won't be able to anyway until there's a physio or a nurse available to allow that to happen. With the spinal, it's very similar to that of a general anaesthetic when it comes to eating and drinking beforehand. You still need to be fasted for 6 hours for food. But you can have clear fluids, that's water, anything that you can see through, black coffee, black tea, up to 2 hours before the operation. We recommend you not have any carbonated drinks or anything that has pulp in it, like orange juice. So what are the differences between a spinal and a general anaesthetic? Well, with a spinal anaesthetic, because you're numb waist downwards, we can carry on with your procedure without you actually needing to be asleep. Although some of you will require some sedation, where you'll be in a twilight zone, twilight sleep. Some of you won't be able to have a spinal anaesthetic, unfortunately, for one reason or another. Some of it may be related to previous surgery, in which case we'll have to do a general anaesthetic. In a general anaesthetic, you're going to be completely asleep. Obviously in the spinal, because we've numbed you from waist downwards, you can be asleep if you want to, but most people will stay awake. Rest assured, during your general anaesthetic, you will be looked after. And one of the ways is by giving pain control through a little port in the back of your hand. Also, the surgeon at the end of the procedure will give you some local anaesthetic into your leg. When you wake up, you'll be in recovery, and that's where the recovery nurse will take over your care.